Okay, good morning. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So today we will see some of the basic rules and understanding regarding how to read the X-rays in childhood clinical practice. Okay, in the childhood clinical practice, knowing about the X-rays is very important. And before going to the details of the disease wise, first we will see what are some of the common rules that you should know when we are dealing with the X-rays. The question is how to read the chest X-ray. Now whenever you want a chest X-ray in a child, most of the time which view you are asking, that is very important. We will write either for PA view or either we will write for AP view. Now usually in bones and all, when you want to take the X-ray of the bones, as in case of fractures and all those things, so usually we will go for AP view. But when you talk about the chest X-rays, most of the time or always we will go for PA view, posterior anterior view. That means rays are passed through the from the posterior to the anterior side. The X-ray rays are passed through the body from the posterior side to the anterior side. Now, if you look into the basics, why we are going for a PA view instead of AP view in case of chest X-ray is, actually in case of chest X-ray, we want to visualize the chest areas clearly. Okay, chest areas clearly. And if we go for AP view, what happens is, the heart comes in between. The heart comes in between. So therefore, that heart will going to block the rest of the view of the chest. To avoid the masking of the chest by the heart shadow, most of the time we go for PA view in case of chest X-rays. Of course, we can also go for lateral view to have better understanding. But most commonly we will go for PA view, and always we will go for PA view, because if you go for a AP view, what happens is heart will come in between and the clear-cut visualization of the chest is not possible. So this is the first step that we should know when we are reading the X-rays, that whether this X-ray has been taken on PA view or whether this X-ray has been taken AP view. In chest X-ray, always we'll say it should be a PA view. Now when we are reading the X-rays, some of the points should be very clear. Now many times when you hold the X-ray in your hand, we don't know from where we have to start and what are the things that we have to see one by one. So it's very clear that you should follow the algorithm A, B, C, D, E, F, G, H and I. So whenever you hold the X-rays, you always remember these 6 or 7 letters. Very simple. In the X-ray, what we have to see is, number 1 is A. You have to look into the airway. Airway means bronchus, trachea, bronchial trees, bronchovesicular marking. Okay. Then B stands for bone. The chest also contains so many bony portions. There are ribs, there is sternum, there is clavicle, and there is also vertebra on the posterior side. So many bones are there. So you need to identify whether the bones are visible or where actually they are. C stands for cardiac shadow. Now look into the cardiac shadow. Cardiac shadow, whether it is normal, whether it is increased, cardiothoracic ratio we talk about, which is 7:5. So cardiothoracic ratio, whether it is increased or decreased, or whether cardiac shadow is displaced to other side. And this point you have to see in C. Next go for D. In the D you look for diaphragm. Okay, diaphragm. The position of the diaphragm is very important. Diaphragm is basically a dome-shaped structure. We know that. Sometimes this diaphragm may be flattened, or sometimes this diaphragm may be interrupted in between. Suppose it may be flattened in case of pleural effusion or any fluid pathologies. It may be much more elevated. Okay, it is elevated more, maybe whenever there is any liver pathologies which is pushing the diaphragm upward, or sometime when you are taking the film in the expiratory phase. Okay, so position of the diaphragm. So diaphragm itself forms some of the angles in the X-ray. Okay, one is costophrenic angle, another one is cardiophrenic angle. Now, in relation to diaphragm, you have to also look into this costophrenic and cardiac angles that we will discuss. Next is E. Now, E stands for exposure. Now, this is very important, whether the chest is properly exposed or not while taking the X-ray. So that is also very, very important. Okay, usually we prefer to take the X-rays in the inspiration phase, and suppose the exposure is not clear and you are taken the X-ray in the expiration phase, then you are not able to see much of the information because chest cavity is not expanded. So E stand for exposure. F stand for fissures. There are many fissures in the lung. Okay, anterior fissures, posterior fissures. So many fissures are there, and we look into these fissures. The upper lobe and mid lobe of the right lung is divided by some of the fissure, horizontal fissures. Okay, transverse fissure. Now the area where these fissures are there, okay, the area where these fissures are there, they create some of the lines in the X-ray. Okay, so they create some of the lines, and these lines are called Curley lines. Okay, so that also we will see in the next class. But important is exposure is important, whether it's completely exposed. Suppose if the exposure is not proper, then you cannot look into the X-rays. Then fissures we have seen. Then G stand for gastric bubble, gastric or stomach bubble. So just below the heart shadow or diaphragm in the left side, we will find another a black shadow always in the X-ray, and that black shadow is nothing but the shadow of the air-filled stomach. So now presence of this gastric bubble or gastric shadow, so that is also very important. We have to see whether this gastric shadow is present. If it is present, whether it is present in place or whether it is displaced or whether it is overshadowed. Okay, so many times the stomach may be filled with more and more air, and so many perforation and all those conditions that so therefore it has to be also understood. So G stand for gastric shadow. H stand for hilum. Hilum is referred to the medial surface of the lung. In both the lungs, the medial surface of the lung is also called as a hilar surface. The name hilar surface or hilum comes because it contains predominantly the hilar group of lymph nodes. Hilar group of the lymph nodes. Now, there may be the enlargement of the hilar groups of lymph nodes. Okay, so that lymph nodes usually they are little solid structure. So they are looking like a whitish shadow, white shadow. Okay, air whenever it's present, it gives a black color, black shadow. Whereas the soft tissues may be the hard tissues like bone or the enlarged these lymph nodes, etc. So they give the whitish color. The fibrotic bands also give some whitish or black mixed color. So now hilum has to be seen. Now in children especially, any changes in the hilum should be understood very clearly, because usually the hilar lymph nodes are get enlarged in children owing to any type of exposure to infection or allergy, etc. Especially those children who are getting the BCG vaccinations. So usually their hilar lymph nodes will be enlarged, and that particular area looks like whitish, okay, because of the formation of the primary complex. We know that the formation of the primary complex is very typical of a tuberculosis in children. So those babies who are given vaccination against tuberculosis, also there is formation of a primary cortex like structure which will going to heal later, and that gives the whitish color. I stand for intercostal space. Now this is very important. Intercostal space. Okay, I stand for, actually in the anterior area we are looking for the intercostal space. So we know that intercostal spaces are always obliquely faced. Okay, the ribs are not straightly placed, or they are not horizontally placed. Rather, ribs are placed obliquely. So we will say bucket handle type of movement and all those things. So ribs are actually obliquely faced. So and natural, obviously, it should be the intercostal space should be also obliquely present. So now while you're counting the intercostal space, it has to be counted in the oblique way, okay, not in the horizontal way. If you go on counting in the horizontal way, so then you will miss the calculation. So therefore you have to calculate it on the oblique way. So it starts from the anterior side and goes back posteriorly. Okay, so now these are A, B, C, D, E, F, G, H, I. So these are the basic factor. So when you hold the X-ray in your hand, so these are the first impression that you are getting, that you have to look into all these points. So once you are looking to all these points, then very rarely you miss the chances. Okay, diaphragm, fissures, gastric bubble, hilum, intercostal space. So it's very simple to remember A, B, C, D. Okay, so now we move on to the next important thing, that is exposure. Well, taking the X-ray, there may be some of the technical errors that is quite common when X-ray is taken from an unexperienced or unexpert who is not expert in the field of X-ray. So these problems may be there, or sometimes it's very difficult to take the X-rays in the children because they very rarely follow the commands of inspiration, expiration, etc. So when the technician is telling that take the deep breathing, so child may go for expiration also. Okay, so therefore it's not only the technical part, there is some cooperation part is also there. Now, whenever you get the X-ray, whenever you get an X-ray, what you have to see is either with overexposure or underexposure. Both are very important, ati and less. So over and underexposure, both is important. Now, if you are able to count, now this is very important thing. If you are able to count the vertebral spines in the above 4 or 5 spines, then usually it is called as good exposure. Now, when you take the X-ray, in the X-ray we are looking at the anterior part, but if you see carefully in the midline, the white portion which we are seeing, that is nothing but the vertebral column. Now, if you are able to count the spines, at least 4 to 5 spines, cervical 1, cervical 2, cervical 3, 4 or 5 spines, so that itself suggests that exposure is good. Okay, that suggests that exposure is good. And the spines are not visible, the spines you are not able to count, that suggests that the exposure is not good. Now, if you are able to count all the spines, that means starting from the cervical area to the lumbar area, if you are able to count all the spines, then we will usually call it as overexposure. Okay, it's overexposure. And if you are not able to count any of the spines, or only 1 or 2 spines you are able to count, then it is called as underexposure. So immediately what you have to look at is bone, A, B, bones. In the bones you have to look into the vertebrae. It depends upon the vertebrae. Okay, so that means if you are able to count the vertebrae, about 4 or 5 vertebrae, okay, on the posterior side of the X-ray, then it's called as good exposure. And you're not able to count many of the spines, only 1 or 2, it's underexposure. And sometimes you're able to count till the lumbar vertebra also, then it's a overexposure. So this part has to be clear. Now looking into this particular X-ray, now are you able to count the spines? Now see, this is a spine now over here, so we are able to count the spines up to 1, 2, 3, 4 of some of the spines, but here in the down position it's very difficult to count them. Okay, so now look at the vertebral column behind the heart. Okay, just behind the heart area over here, just look at the vertebral column. If you can see the dilated spine behind the heart and able to see the pulmonary vessels periphery, it's considered as good exposure. This is another important point of exposure. One point we have seen, so that's about the spine. Another point is, if you can look at the cardiac column behind the heart over here, okay, vertebral column, this particular portion. Okay, now here, if you are able to see the spines behind the heart, okay, So you should be able to see some of the spines behind the heart area, and also you're able to see some of the pulmonary vessels peripherally. So this is the spine, and peripherally some of the pulmonary vessels are going out over here. So if you're able to see on the X-ray, then we'll usually call that X-ray is good exposure. Good exposure. Another important thing is how to make out the inspiratory or expiratory film. Now, when the film comes to your hand, you should be in a position to tell that whether this film has been taken in the inspiratory position or inspiratory phase or expiratory phase, isn't it? Children may not cooperate many of the times, or sometimes technical problems may be also there. So now, if it is the inspiratory film, this is just a common sense. Suppose if the X-ray has been taken during inspiration, of course the lungs are very well get expanded. Okay, the lungs are very well get expanded, and usually technician will take say to hold the breath during the film take, isn't it? So we know that. So while taking the chest X-ray, the technician will say take the deep breath and then hold it. So when you're holding, he will take the X-ray. That means during the inspiration you're holding, your whole chest has been get extended now. So now, so film may be taken either in inspiration or expiration, because baby sometime may not follow any command. Okay, now how to find out? Now, if it is inspirational film is taken properly, so diaphragm look higher in the expiratory film now, and it will be lower in the inspiratory film. If you look into the diaphragm, usually diaphragm moves downwards during inspiration. So if the film has been taken in the inspiration, then diaphragm has to be there in the lower side. Suppose the film has been taken in the expiration, then diaphragm will be in the upper side. That we will see in the X-ray now, one of the example. Remember this point number 1, diaphragm. Number 2, in the expiratory film, the lot of shadow of the heart is below the diaphragm. Expiratory film, that means the lung has been drawn upward, isn't it? So that means it will coincide with the heart shadow also. So the expiratory film, what actually happens is a lot of shadow in the left side, which overside or coincide with the heart below the diaphragm. While if it is the inspiratory film, only few portion of the heart shadow will be below the diaphragm. This is very important. If the film has been taken in the expiration position, then your cardiac shadow, more portion of the cardiac shadow is now over the diaphragm. And if the film has been taken in the inspiration, then because of the expansion, what happens? Very few portion of the cardiac shadow will be there touching with the diaphragm. Okay, touching with the diaphragm. That we will see again. Okay, so only few portion of the heart shadow will be there. Second is, you can look at the ribs and count the ribs. This is very important. Okay, look at the ribs and count the ribs. How to count the ribs in X-ray? We have to count the anterior end. You should not go for the posterior. Posterior is present posteriorly. Okay, so a rib has got an anterior and posterior end. Sometimes you may commit the mistake that you have counted both the ends. Okay, and the numbering is going on. So how to count the ribs in X-ray? Always we have to count only the anterior end, the last part of the cartilage, and it is not bony. The last part of the cartilage is not bony portion. It's only cartilaginous portion. So we have to count the anterior end only, because we know that the bones ribs posterior, they contain the cartilages. Okay. Now, if the diaphragm cross the third or fourth rib, when you count in the ribs, if the diaphragm is there at the level of the third or fourth rib, so it is suggested that this film has been taken in the expiration, because lung is not expanded over here. But if the diaphragm crosses, if it crosses the fifth or sixth rib, so then it suggests that it is inspiratory film or a normal film. Now, if you look at here, in this particular example, things are very clear. Do you say this is inspiratory film or expiratory film? How much heart project below the diaphragm? Now we know that, see, this is diaphragm, which is present over here. This is also diaphragm. In this picture also, this is diaphragm, okay, dome of the diaphragm. This is the stomach shadow. This is also dome of the diaphragm. Now here if you see, okay, so how much of the heart shadow is over the diaphragm? Okay, here you see how much of the heart shadow is over the diaphragm. If the heart shadow over the diaphragm is more, then it is expiratory. If the heart shadow over the diaphragm is very less, then it is inspiratory. This is number one. Another is you start counting the ribs. Okay, so only 3 or 4 ribs are counted, as you can see in this particular second picture. Okay, so ribs, how much you can count actually here. So while counting, you have to count the anterior end, otherwise it can create the problem. Now this is 1 rib, this is 2nd rib, this is 3rd rib. Okay, so you have to count the only anterior ends. Now in this case, only 2 or 3 ribs are clearly visible. 1, 2, 3. Okay, so but here the ribs visible are 1, 2, 3, 4, 5. So by looking at the number of ribs which are visible, we can have better examples also, I think, that we'll see. Okay, by looking at the counting of the ribs, we can say that it's inspiratory or expiratory. So preferably X-ray should be always inspiratory film. So how to know this? One is diaphragm position in relation to the heart. Another one is counting of the ribs. If only few ribs are available, it is visible, it suggests that it is an expiratory film. If more ribs are visible, then it is a inspiratory film or a normal film. Now another important thing that you have to see in case of X-ray reading is rotation. Okay, what do you mean by rotation? How do you look at rotation? If the film is central, then now we always prefer to take a film which is centrally placed. Sometimes the film has been taken in more inclining to the left side, sometimes maybe to the right side. So then that is called as rotation. If the film is centrally placed, what are the identification marks? If the film is centrally placed, then the mediastinum will be centrally placed, isn't it? So mediastinum will be centrally, and both the clavicles will be at equidistant from another. Dono clavicles, so they will be equidistant from one another. Okay, from the center line of sternum, and the clavicles will be present from equidistant from the central line. Now if it is not centrally placed, then so you will have you don't have the equidistance from the both of the clavicle from the both sides. That again we will see. Both the clavicles medial ends are there at the same distance from the center. This is we have to see. दोनों clavicle का जो medial ends है वो central line से equidistance में है क्या? So if it is present equidistance, so then it suggests that yes, X-ray is centrally placed. Or one lung looks blacker than the other lung. This is another criteria. Okay, usually in a normal lung, both the lungs should be equally black. Air shadow should be equal. Sometimes one lung is more blacker compared to the other lung. Okay, so this is also possible because of the rotation problem. When you're not placing normally in the central, then sometimes the shadows may differ. Normally we have a very thin line of heart shadow on the right side. Right side, if you see, the heart shadow is very thin, wasn't it? Left side the heart shadow is very prominent. In the right side it is very thin line. Only few portion of the left lung will be occupied by the heart shadow. But if it is more occupied, of course in the abnormal condition like right ventricular hypertrophy, it's a different issue. In a normal child, if it is more than, then we have to think about some rotation. We have to think about some of the rotation. So this is another important point, rotation, that we have to see. Now if you look into these pictures, the things will be very clear here. See, this is one of the example of rotation. The anterior ribs equidistant from the ipsilateral pedicles. Okay, so not rotated. That means, see, this is a central portion. The anterior ribs, we have taken the clavicle in the example, but the anterior end, the anterior ribs are equidistant from the ipsilateral pedicles. Okay, So this suggests there is no rotation, it is equidistance. Similarly, if is one lung is blacker than the other, you can see over here. So this is comparatively equally black. Okay, this is equally black. And are the medial aspects of the clavicle are symmetrical? You look into second picture over here. So if these are the spines are visible over here, spines. Okay, so if this is a central line, whether this middle end of the clavicle, they are equidistant from the central line, that we have to see. And that if it is not there, so it suggests that it is rotated film. It is not a non-rotated film, it is a rotated film. There is the positioning is not proper when you are taking. Okay, now first one is expiratory plate, looks like a consolidation. Okay, we will go back to this particular picture. How many ribs are visible here? This is the diaphragm, this is the one rib, this is the second, third, fourth. Okay, so this is one rib, anterior end, 1, 2, 3, only 4, 5. Okay, 4 or 5 ribs are visible. Now question is, this is an underexposed film actually. Okay, more ribs are not visible here, not clearly visible, and it also looks like a consolidation. When you go for that, it also looks like a consolidation. Is it consolidation? No. It looks like that it is overexposed, as lower vertebra is also seen, and the rotation may be slightly rotated, as there is a slight difference in the right and left side. If you see this particular film, yes, we are talking about this particular film. Okay, so now if you count the ribs over here, 1, 2, 3, 4, this looks like an overexposed, isn't it? Overexposed film. Okay, now if you look into the spines also, even in the lumbar area also, you can look into the spines. So this is an overexposed film. Okay, but this looks like now consolidation, a totally whitish area hai yahan pe. So it looks like a consolidation. Okay, looks like a consolidation. Now the question is, in the first picture we are seeing the rotation may be slightly rotated, as there is a slight difference in the right and left sides. There is a slight difference in the right and left side, isn't it? Right side is less extended and left side is mostly overextended. So there is some problem. There is no problem in the exposure, but in the rotation there is some problem. In the rotation there is some problem, because दोनों साइड जो है सेंट्रल से इक्विडिस्टेंस नहीं लग रहा है. मिडिल एंड ऑफ द क्लेविकल हो सकता है या एंटीरियर एंड ऑफ द रिब्स हो सकता है. ओके, so because of this rotational problem, now a patient, this X-ray looks like a X-ray of a consolidation, but it is not actually consolidation. It's simply a rotation problem. Now another is, do you see the left hemithorax in this X-ray? It is full of hard shadow, so we can hardly see any of the gas area. But in the right thorax, the homogeneous opacity of air bronchogram is seen. Now this looks like a consolidation, but this film is expiratory film. Count the ribs. I will go for the okay. So this is an expiratory plate. Expiratory plate actually, because it is underexposed, and also the rotation is not proper, so therefore it looks like a consolidation. So why? Because it is because of rotation problem, the hard shadow has been shifted to the right side, therefore it looks like a whitish patch. Okay, now this is actually good inspiratory plate. Now this is a very good inspiratory plate. Okay, the exposure is also good. So good inspirator plate reveals it to be a thymus demonstrated by the sail train. Now here also see this particular portion, if you see, है ना, ये जो है ज़्यादा whitish दिख रहा है, ठीक है. सो ये जो whitish है एक्चुअली दिस इज अ शैडो ऑफ द thymus. सी दिस पर्टिकुलर दिस ये जो शेप है ना यहाँ पे इस तरीके के, सो एक्चुअली दिस इज अ शैडो ऑफ द thymus, शैडो ऑफ द thymus. नाउ दिस इज ऑल्सो कॉल्ड सेल ट्रेन बोलते, सेल ट्रेन साइन बोलते हैं हम. जैसे ये सेल ट्रेन जो समुद्र में जो चलते हैं ना, जो जो बोट्स वगैरह चलता है उसमें एक लगा के रखते हैं, ठीक है, तो वो जो है सेल बोलते हैं हम उसको, सेल साइन बोलते हैं. सो दैट सजेस्ट योर प्रेजेंस ऑफ द thymus in the newborn babies or in the infants. The thymus is very active, so this particular thymus may give rise to this particular appearance. Now all such things will be easily understood when the exposure is good and when the exposure is good and the film has been taken in the inspiratory phase. Otherwise such type of differences cannot be identified so easily. Now chest x-ray PA view centrally placed over. So this is some of the important parts in relation to the x-ray reading. So before starting any of the interpretation, these are the rules that you have to understand. Now some few more things are there about Schiller's sign is there, then about the costophrenic angle. So many things are there that we will see in the next class.